Hello everyone. Today we will talk about harmful products for the kidneys. The video will also help you learn about a special diet for kidney health. So I ask you to watch the video to the end. I ask those who have not yet subscribed to the channel but appreciate our work to subscribe. Just click the red subscribe button. Thank you in advance. So, the kidneys play an important role in our body. They filter the blood, participate in urine formation, regulate water balance, and also remove toxins and breakdown products. The kidneys also participate in the synthesis of vitamin D and maintain blood pressure and acid-base balance. Disruption of their function affects the entire body and significantly worsens the quality of life, often leading to disability or death. People with kidney pathology are recommended to completely exclude from their diet products that negatively affect them. The relationship between dietary habits and kidney health is very important. Excessive consumption in the diet of foods rich in potassium or phosphorus can disrupt kidney function. This can lead to the formation of kidney stones where deposits accumulate in the organ, capable of damaging the walls of the urinary tract and contributing to the attachment of infection. Dietary recommendations largely depend on the current state of the kidneys. If their function is normal or only slightly reduced, then there are no special restrictions required. If there is a significant impairment of function, then the consumption of potassium and phosphorus in food can worsen the situation. Here are 10 foods that should be limited for people with diseases of the urinary tract and kidneys. First, fatty foods and processed foods. Fatty foods can lead to the formation of a large amount of oxalates in the kidneys, which is dangerous for the formation of stones. Excessive consumption of animal fats disrupts the absorption of beneficial substances, such as vitamins B6, A and D, and genius micronutrients. Offal rich in fats should also be excluded from the diet. Second, young meat. Meat is a source of purine bases. An excess of them in food disrupts purine metabolism in the body and leads to the deposition of urates or uric acid salts in organs and tissues, including in the renal parenchyma. It is recommended to limit the consumption of meat from young animals, as it contains the most purine bases. With significant impairment of organ function, it is recommended to completely exclude meat, especially if there is urinary retention, which significantly worsens the situation. Third, seafood. Scientists from Russia have proven that a large amount of vitamin D in the body contributes to increased absorption of calcium from the intestines and, as a result, its excessive excretion with urine. In people with urolithiasis, the level of calcium is practically always increased. Therefore, to prevent excessive intake of calcium and subsequent formation of kidney stones, it is necessary to limit the consumption of products rich in this micronutrient. It is necessary to limit the consumption of fatty fish and fish oil. Fourth, carbonated water. They are not as harmless as they seem at first glance, especially for the kidneys. There are two reasons. The first is a high sugar content, which is dangerous for the development of type 2 diabetes, which primarily damages the kidneys, as well as other organs. The second reason is the addition of a lot of phosphorus, which poorly binds to blood proteins and remains in a free form for a long time. Excessive intake of phosphorus into the blood and its insufficient excretion leads to the formation of concrements in the renal tissue and damage to the mucous membrane of the tubules. People with urinary tract diseases are prohibited from consuming such drinks to avoid exacerbating the condition. Fifth, avocado. This vegetable has many beneficial properties, which is why it is widely used in folk medicine. It is rich in beneficial fats for the heart, fiber for the intestines, and antioxidants for the entire body. However, people with kidney pathology should be more careful. Avocado contains a lot of potassium, about 500 milligrams per 100 grams of vegetable. With impaired kidney function, potassium is not excreted from the body with urine. Its excess is dangerous for the heart as it can cause rhythm disturbances and even arrhythmia. Sixth, dairy products. Their excess in the diet has a harmful effect on the kidneys. These products contain phosphorus, potassium, and protein. All three components can damage the renal parenchyma and impair its function. A high level of potassium in the blood has a negative effect on the heart. Phosphorus causes the formation of kidney stones, and protein presents a significant burden for damaged kidneys, exacerbating the progression of renal insufficiency. It is recommended to replace regular milk with rice or almond milk, which contain much less phosphorus and potassium. Seventh, processed foods. These products are generally unnecessary in anyone's diet, as they do not provide any benefits. We are talking about sausages, canned fish, and other similar products. They contain food additives, spices, a lot of salt, and preservatives, which have not only toxic effects. As a result of their impact, normal kidney tissue is replaced by connective tissue, which can no longer perform the organ's function. A decrease in organ function leads to the development of irreversible damage known as renal insufficiency. Scientists have shown that consuming these products increases the risk factors for developing arterial hypertension and edematous syndrome. American scientists have established a direct relationship between the development of ischemic heart disease and the consumption of processed foods. Eighth, dried fruits. They are prohibited for patients with kidney insufficiency because despite their many beneficial properties, they contain an excess of potassium, which negatively affects the kidneys. Although dried fruits themselves are very beneficial, rich in vitamins C and A, and fiber necessary for digestion in the intestines. In 100 grams of prunes, there is about 800 milligrams of potassium, which is almost half of its daily norm. The potassium content in apricots is even higher. Therefore, people with kidney disease need to limit their consumption of these dried fruits. Ninth, fast food. We are talking about products that do not require cooking. It is enough to pour boiling water over them, and they are ready to eat. This is extremely harmful food. It contains an excess of salt, the excess of which causes an increase in blood pressure and edema. Also, such food contains monosodium glutamate, which enhances the taste sensations of the dish and stimulates appetite. As a result, a person consumes more of the product than necessary, which is dangerous for the appearance of excess weight and the deposition of fat in the kidneys. In addition, fast food products generally lack essential nutrients. A person simply consumes some empty calories, feeling hungry again in 30 minutes. Moreover, such food is harmful to all organs. 10th, potatoes. This vegetable is also dangerous for the kidneys due to its high potassium content. In 100 grams of potatoes, there is up to 500 milligrams of this micronutrient. To reduce the potassium content, you can soak the vegetable in water for about 4 hours. Thanks to this method, the amount of the micronutrient is reduced by almost half, making the product more dietary. People with kidney and urinary tract pathologies should limit the consumption of potatoes due to excess potassium. 7 basic rules of a diet to maintain kidney function at an adequate level. 1. Consume an adequate amount of fluids. Maintaining normal fluid balance promotes the excretion of harmful substances from the body and prevents the formation of kidney stones. The recommended fluid intake for an adult is about 1.5 to 2 liters per day. This varies depending on physical activity and health status. Eat a varied diet. Long-term consumption of the same foods is not recommended. The diet should be rich in vitamins, micronutrients, and fiber, which can be obtained from vegetables, fruits, and foods containing proteins, fats, and carbohydrates. Exclude fatty foods from the diet. Consuming large amounts of animal fats increases the presence of oxalates in the blood, leading to their deposition in kidney tissues and the formation of stones. Avoid harmful habits. Alcohol directly damages the renal tubules mucous membranes. Smoking triggers an autoimmune reaction and accelerates the progression of kidney disease. Maintain adequate physical activity. Daily aerobic exercises such as outdoor walks or swimming are recommended. These moderate exercises improve metabolism, reduce the risk of obesity, and boost immunity. Eat frequently and in small portions. This principle benefits not only the kidneys, but also the gastrointestinal tract. Consuming food in 5 to 6 small meals throughout the day helps the kidneys function normally without overloading them. Seek timely medical attention if any changes in kidney or urinary tract function are detected. These changes may include increasing weakness, lethargy, nausea, lack of urine output, or pain in the lumbar region. Following these simple principles is the best preventive measure against kidney and urinary tract damage. Limiting the listed above products slows the progression of renal insufficiency and prevents complications. That concludes the video. On this channel, you can find many interesting videos about the benefits and harms of vegetables and fruits, as well as diseases and their treatment methods. Please don't forget to subscribe to the channel, hit the notification bell, like the video, and share it with your family and friends. This was the Health Body channel. Until next time.